former president of the Royal Australasian College of Physicians, has slammed the St Vincent's Hospital policy, which is fast-tracking care for Indigenous patients. Professor John Wilson is also a former member of Alfred Health's Ethics Committee and warns that the policy requiring all Indigenous patients be assigned a minimum Category 3 in triage goes against medical codes of conduct. Here's what the Victorian Health Minister had to say when asked about the professor's concerns.
Let's be clear that the sickest patients are always seen first. That is the case across every health service here in Victoria. We also know that a number of people with less urgent care needs present to our emergency departments every day, and they will wait. That is certainly not my understanding. As I said, the priority to treat the sickest patients first is always a priority for our health services.
I'm pleased to say Professor John Wilson joins me now. Thank you for your time, Professor. In what ways do you believe this policy breaches medical principles which prohibit discrimination?
Yes, good evening, Peter. I guess that the fundamental concern here is the concept of racism and discrimination. And we have fought long and hard over many years, and lives have been lost to defend the equity of healthcare across this country. I do not believe for one second that prioritising one racial group over another is anything but discrimination. I don't think there's a place for that. And in fact, even the Health Department's report released today, amongst a myriad of other reports, actually says there is no place for racism or discrimination. So I think we're all one here on the definition. And is it just semantics? Are we trying to sneak in some other kind of policy about a group that we're not describing as being racially different? Well, of course we are. And here is a situation where doctors are being asked to act in a way that is not permitted by the Medical Board of Australia.
So that then puts the doctors and any registered practitioner there, nurses and others, in a very difficult position where they could be going against the ethics of their licensing body on the say-so of St Vincent's Hospital. Now, if St Vincent's Hospital's out of line, surely it's the job of the Victorian Government and the Health Minister and the Health Department to bring them back into line. But you listen to the Premier and you listen to the Minister, we just played her comments today then. They seem to be backing in this policy.
Well, you see, isn't that an interesting point that you make, Peter, that I don't know who it is that made this decision about prioritisation of one particular racial group. I don't know. All I've heard is that there is a policy and that staff have been directed to a particular action, which I believe is in contravention of the Code of Conduct of Medical Board of Australia. So firstly, who is it that actually made the decision? Secondly, once a decision's been made, it's been announced, it's now in the media, I don't see any reason why there needs to be a doubling down on a policy that may be flawed. In your introduction earlier on, you mentioned this is a situation where we may have crossed the Rubicon. Well, there's a risk that you might slip and fall in. And this is one of those where I believe there has been minimal consultation with appropriate professional groups, because this would need to dovetail nicely with the Medical Board's position, nicely with the colleges, the College of Emergency Medicine, and indeed very much so with the AMA and practitioners in this country. Otherwise, what we'll see is a flow on to other states, other decisions that will be racially based. And again, in the face of advice and codes of conduct that we all have lived by for decades.
I have a sister who's a midwife and she works in an emergency department, and this rationale very early on was that Indigenous people are waiting longer than others when they present to emergency. But that implies that somehow they're being held back by their race, when in fact, if all the medical professionals there were doing the right thing by triage and only ranking based on urgent health need, the fact that Aboriginal people might be slow to be seen, it would be because not that they're Aboriginal, but their health needs at that time were not as urgent as others. So upending this based on race is sort of implying, isn't it, that these medical professionals were not doing their job, or perhaps that they were discriminating against Aboriginal people based on race. Hence this need to have this positive discrimination.
Yes, Peter, and in fact, all of those may be true. But I would like to see the evidence that identifies which part of that is the one that we can address, and how can we do it in a way that is not discriminatory to start with. This means that almost anybody who comes from a non-English speaking background, anyone who's culturally disadvantaged, may need extra assistance. There may be need for more cultural training in our healthcare system because of the way in which our population has demographically evolved so rapidly over the last few years. And I believe there is a situation now where the lawmakers have suddenly jumped right over professional consultation and gone to a conclusion that they believe is appropriate, where in fact it may not be in the best interests of our community.
So just before we go, do we need then, I guess, the federal government, given they fund so much of the health sector, and you make the point that this could end up in other states and other jurisdictions, do we need the federal government to come out here and have a statement in principle to say, no, we actually reject what Victoria is doing and we want all the hospitals to continue ranking people based on urgent medical need as opposed to race?
Well, it's very interesting you asked that question, Peter, because the Honourable Mark Butler, our Federal Minister for Health, has forwarded a most wonderful document called the Emergency Triage Education Kit. And that education kit spells out how triage and care should be undertaken. It spells out very clearly that Indigenous populations may need special attention at particular times. It does not deviate from the principle that severity is the number 1, 2, and 3 reason for triaging attention to patients. So there is a document there already. It's already signed off by the Federal Health Minister. I don't think we need to go further. Just look at it.
All right, this issue will not go away. Thank you for your very frank and fulsome remarks.